So I'll be introducing Dr. Victoria Fast. It's a real pleasure and honor for me to do that. Dr. Fast started at the University of Calgary in 2021 and already has over 45 publications. So extremely productive, but also just a really inspiring person. She's an associate professor in the Department of Geography at the University of Calgary and the academic co-lead for Cities and Societies and the Institutes for Transdisciplinary Scholarship. She leads the Accessible Mapping Research Lab and is a national leader in community-engaged accessibility research, which helps translate lived experience into practical actions. Today, her talk will share a fresh way of thinking about accessibility, one that expands what it looks like to build environments that work better for a lot more people, and that offers a practical lens for thinking about what it means to break barriers. So I'm really excited for Dr. Fast to come and share some of her really unique community-engaged research with us. Come on up.
Thank you so much. I am so happy to be here and really picking up from Bonnie's talk on seeing barriers and how to remove them. And so, wonderful, thank you. Just to start, I'm Victoria. I have a white woman with brown hair, brown eyes, average height, average size. I'm wearing a black blazer. While I do not have any visible disabilities, I do have multiple invisible disabilities. And I'm really pleased to be here for Breaking Barriers Day. And I want to begin by saying that this title, Beyond Ramp, is not because ramps don't matter. It's that ramps matter enormously, but accessibility is not finished once a ramp exists. And that accessibility is really about whether people can actually arrive, enter, move, rest, navigate, regulate, fully participate, and belong in a space. And this is what I want to talk about today, is those barriers that often hide in plain sight. And so I'm showing you an example from a university where there was a ramp next to a staircase, but you could tell there was efforts to not only hide the ramp behind a planter, but also a garbage and then another planter. And so part of the access strategy about breaking this barrier was adding a sign so that people who need to use the ramp actually can identify it. And so these barriers don't always show up in our data sets, in our maps, our audits, or our institutional systems, but they shape whether people can participate fully in daily life. And so, but before I begin to share my research, I really want to take a minute to honor what Breaking Barriers Day is really about. Breaking barriers is not just about changing policies, building standards or systems, but it's also about creating supportive community. And that starts here with the people in this room and online. And I want to invite us to break barriers by breaking the ice. So I encourage you to take a moment to notice the room around you, the people beside you and the energy in this space, and the shared commitment that brought us all here. These are the people who have chosen to be here because they care about access, they care about disability, they care about health, design, movement, care, and participation. These are the perspectives and the people worth knowing. So if you are comfortable, I welcome you to take a minute to introduce yourself to someone beside you. Share your name, where you're joining from, and maybe one aspect of the built environment that you often think gets overlooked in accessibility. If you're joining online, or if quiet reflection feels better for you, then that's welcome too. You might simply think about why you're here and what breaking barriers means to you today. Thank you so much for taking this moment to connect with yourself and connect with those around you. The one thing I love about accessibility work is that it begins with listening. Every time I talk with students, with staff, faculty, community members about their experience moving through a campus or a city, I learn something new about the environments that we share and the assumptions built into them. So thank you for being part of Breaking Barriers Day. A little bit more about me. I run the Accessible Mapping Research Lab at the University of Calgary, and it is a brilliant team dedicated to researching, mapping, and expanding our understanding of the barriers that those with visible and invisible disabilities face in the built environment. Over the years, we have worked on a number of mapping projects that try to make accessibility visible through mapping. But I don't think of maps just as technical objects. A map is not only a picture of what already exists, it can be a way of asking, what are we noticing, what are we missing, and whose experiences are being treated as data. And for example, here's a project that I worked on with Vancouver Island University. They wanted to redo their campus map because a lot of people expressed concerns navigating this really difficult campus. So take a moment to notice this map. You can see the priorities of the map maker are reflected in it. So you will see that on this map in the legend, there is bicycle parking and covered bicycle parking. No surprise then that the map maker was somebody who is an avid cyclist who would tell anyone who would listen that they bike to work every single day of the year, regardless of the weather. Right? Our maps embed people's values and their assumptions, and often disabled perspectives are left out. So this map doesn't have any indication of what path is accessible, what path doesn't have stairs, where's there a ramp, what door should I go in, where is there a door that has an automatic door button. And so this was a project that we undertook, is recreating the map to be more inclusive, to show doors, elevators, ramps. And if you look closer, there is also a Starbucks logo on that. Because they said to me, they'll print the map for me if I put the logo on it. I said, how big? So this is the new campus map at VIU that students and visitors and staff and faculty and the community can use to then be more comfortable navigating the campus, not just while they're there, but even before you get there to have better information to support route planning. Another project I've done was using participatory tools such as Walk Roll Map to collect the experiences of barriers and hazards directly from community members. So this we look at we ask information about missing amenities such as where's the sidewalk, incidences such as conflicts, and then hazards and concerns. This was created out of a successful project called Bike Maps, where they really wanted to map near misses. And near misses are really important data that's not actually captured as data, but tell us where the built environment can be more dangerous. Again, interestingly, digging a little bit deeper in this, we see the persistent underrepresentation of people with disabilities, and we don't actually ask about neurodiversities. So we only see 11% of older adults reporting, and only 7% of people with disabilities reporting in the data set that at that time had over 3,000 contributions. Right, so again, the map reflects the needs of the contributors, and this data clearly shows that it's leaving out disabled perspectives. And so as our mapping program evolved, we realized that inclusion could not be achieved by simply documenting physical features. We needed to understand which barriers mattered the most to disabled people themselves, including barriers that are hidden, sensory, cognitive, and deeply context-specific. And so this led us to partnering with Pedesting on a research project designed directly to bring disabled and neurodiverse perspectives into the mapping process. And to ensure that our maps reflect the lived reality of people. I'm so happy to share that Pedesting is a made in Calgary accessibility navigation app designed to help people find easier, safer, more accessible routes through indoor and outdoor spaces. They're one of our vendors today, and Young Young is here as well. So you're welcome to, I encourage you to chat with them and to download the app. Good accomplishment for Pedesting. They actually have done some significant mapping of the Plus 15. So if you ever go to the Plus 15 network and get lost, like I have done almost every time, they now have an app that supports navigation in a lot of Pedesting zones there. What I really appreciate about Pedesting and working with them is that they start from a very practical question. How do people actually move through complex environments? Not just where's the shortest route, but where is the usable route? Where's the entrance I can use, the elevator, the washroom? Pedesting brings deep expertise in navigation, and my team brings a research focus on understanding which barriers matter, how to measure and map them, and how to help institutions act on that knowledge in a way that leads to real change. So to start, our goal is to better understand some of the hidden barriers in the built environment. And so this has been an ongoing multi-year project, and our methods include qualitative and community-engaged research approaches, including workshops, interviews, go-along interviews and focus groups, and participatory mapping where we listen deeply. And our goal was to engage and understand diverse perspectives, such as here we were presenting our research to the Calgary Association of Lifelong Learners in our talks and community walks. I'm also deeply thankful for the work done by the Campus Accessible Mapping and Planning team. A big shout out to Gunpreet, to Habiba, Jason, and Vanuja for being part of this work. And so in this, we learned about the hidden barriers that people experience. And as we continued this work, people kept telling us about barriers that just don't exist into data sets. They told us about lighting that makes routes feel unsafe. They told us about washrooms that did not support chronic disease, menstruation, caregiving, gender diversity, or disability. They told us about the absence of places to sit. And what became clear is that many of the barriers that shape participation are hidden, not because they are minor and not because they are rare, but because our systems have not been designed to notice them. And so we develop methods to notice, to map, and to understand many of these hidden barriers. So in this case, we started with ArcGIS field maps and ArcGIS Survey 123 to the students and faculty here at the University of Calgary campus. We have a university site license, so anyone has access to these really easy to use tools that support our mapping and our analysis. And also just a shout out to actually the Department of Geography. Who would I be without promoting the program that I come from, is that these tools are free for all students. And in geography, we've developed even more programs to support students learning in kind of on the mapping side. So we've just introduced an undergraduate embedded certificate in GIS. We have a master's of GIS and a certificate in geospatial technologies as well. So it's a 4-month program for any of the community rehabilitation students who might be out there who are like, I can really see using mapping in my research, that there's a great way to learn about some of these tools. So happy to chat with you about that as well. Because maps aren't just kind of a product. Maps really are a tool for change. They don't just show us the barriers, but they can help make patterns visible. They can help prioritize decision making. And so they move from, what do we know or what did we not know to now how can we act on these? And so I'm just going to run through kind of three projects and preliminary findings on some of these projects. The first one is I'll talk about is the washroom mapping we did. And so just in the last month, we mapped 353 washrooms on campus. Because accessibility is just not just whether there's an accessible sign on the door, because we often find out and we hear that even though there is that sign on the door, it doesn't mean the washroom is fully accessible. Barriers can include the heavy doors, poor turning spaces, unclear signage, inaccessible sinks or dryers, sensory overload, or even layouts that require more assistance. So again, with an amazing group of student researchers, we had various survey questions for the washrooms here. So we looked at the washroom type, the lip entering it, because they might say it's a roll-in shower or a roll-in something, but often there's an overlook lip there. Whether it's actually accessible, is it a locked washroom, right? Maybe there's an amazing fully loaded, fully accessible washroom, and it's locked and only available in certain hours as well. Automatic doors, the stall width, the sink and soap heights, as well as grab bars. And so here's just some preliminary findings of this, that we notice that there's 42% female washrooms, 40% male, and about 18% universal, which is good to see. And then automatic doors, though, this actually surprised me that the proportion of is so low. That in fact the majority of washrooms, about a third of them, do not have automatic doors to get into them. And the ones that do, 13% of them were not operational, right? So we only have a third that actually have accessible washroom or entry buttons, but then a bunch of them don't actually work. And we didn't put time in, but I'm sure a lot of you recognize this too, right? You press the button, it opens, but then it might even close before you get there. Grab bars, again, 15% did not, which can be a huge problem for a lot of people. And now this finding gets a little bit more complicated, so I'll explain it to you. It's a word cloud, but it's a number frequency cloud. And so this was just all of the results of the sink height from the floor. The standard for this is 0.85 meters or 85 centimeters from the ground. Right? And so we see in this word cloud that actually the most common sink heights are 85, 86, 84, 83 centimeters, right? So you can reasonably expect that you can, walk up or roll up to a sink and, know that it's right about here. Interestingly, so we did the same thing for the soap height from the floor. Right? So again, imagine this, right? You roll up, somebody who's maybe blind or low vision, they roll up to the sink, they know where the sink is, right? It hits you here every time, and then you go get the soap. Here? Nope. Here? No. Here? No. Here? No. Right? That there's so much variability in the soap height dispenser that it would actually be hard to find. And again, when you start thinking about this, the challenge of this is that it's a lot of work, right? It's a lot of work to show up and participate fully if you had to spend 3 minutes trying to find where the soap dispenser was to wash your hands after using the washroom. And so visualizing these data allow us to move from isolated anecdotes to visual patterns. It helps us ask not only does this feature exist, but where is it, who can use it, and what gaps does it create? And washrooms also, what's missing? This was really shocking to me. There were no sharps containers, right? So I said, okay, let's get sharps containers in our data collection. And the team said, but we haven't found any sharps containers. And so I find it's more common in public washrooms, and we're working with the City of Calgary as they're developing their washroom mapping strategy as well, and that they're more likely to map sharps container, or they're more likely to have sharps containers where the campuses overlook that. And this really matters because these are the resources that we need to support the management of chronic diseases. And that, again, we just find you don't have that in many of these instances. So we can see, I don't even have stats for this, we just don't have it, right? We just don't have many. What were there, 1, 2, 3 total on campus? 2, okay, 2. We had 2 out of 353 washrooms. And this is a big one too. Here's a small example from a washroom sign. At first glance, the sign looks accessible. It includes Braille, so it appears to be designed with blind or low vision users in mind, but the sign was printed and laminated. I'm not joking. The Braille was completely flat. It's not raised or embossed, which means it can't be read by touch. And so my team has called this performative Braille. And I think this image actually captures something really important, that this is accessibility as appearance, not accessibility as function. It signals inclusion to people who can see it, but it doesn't provide access for the people who it is actually designed for. And the problem is not simply that someone forgot accessibility. is that accessibility was treated as a visual symbol rather than a lived, usable condition. And this is exactly the kind of hidden barrier that I want to draw attention to in my research. The second example I want to draw on is lighting. This is from a project that we developed called the UCalgary Map for All, which shows different features in the map environment that might be necessary that are not included in our normal campus map. So we can see things like service centers, childcare centers, where food is, where washrooms are, and sidewalk width and slope, and automatic doors. So features that have been overlooked by our regular campus map, but are included in our UCalgary Map for All. This was built on an ArcGIS experience builder, again, part of the tools that actually anyone associated with the University of Calgary has free access to. And so one of the things that I'm highlighting here is lighting. Lighting is often treated as a technical issue or a safety or an aesthetic issue, but it's also an accessibility issue. The campus is not the same place at 10 a.m. as it is at 10 p.m. A route that can feel comfortable in daylight might feel unsafe or disorienting after dark. A pathway that is technically connected may not be usable if the light is uneven, if the sightlines are poor, if glare is intense, or if the route feels isolated. This is especially important in winter when darkness comes early and when snow and cold change the accessibility landscape. Barriers are temporal. They change by time of day, by season, and with weather. And so we see the coverage of the lighting. You can see the coverage of the lighting over the campus is that there are some areas that the lighting is so dense that the lighting or the buffers that we put on the lights based on the lumens in the light overlap. But then you can see large areas of campus that actually don't have the same density of lighting. And so that is often concentrated over parking lots, that these are really important areas of infrastructure that have been left out. And that actually also brings me to the example of rest. When we talk about mobility, we often think of movement, walking, rolling, cycling, driving, taking transit. But for many people, mobility also depends on the ability to rest, to sit, to recover, to wait, to regulate, and to manage pain, fatigue, dizziness, breathlessness, anxiety, or sensory overload. And so here's an example of someone who clearly just needed to take a little break as they were pedestrianing through the parking lot on campus and had to stop because there was no benches, or and had to sit on the cement barrier because there were no benches. So the photo is an older adult sitting on a cement barrier. So flip to my next kind of slide. We can see here, I'll put there's red stars of where the woman was sitting. There are no benches at all. There's no places to rest. And so I think what's important is that we all often think about where benches are and where informal seating are located, but not where they're missing. And so where she was sitting was located in a rest desert. So this map is showing kind of UCalgary bench accessibility, and then looking at different thresholds, because often in walkability literature, the typical threshold is about 800 meters to a kilometer, but actually that's far too large when we think about somebody with mobility constraints. And so some of the literature says about 50, 60 meters threshold for a bench, and so even at the most generous threshold, so we mapped it across 30 meter, 60 meter, and 100 meter thresholds. Even at the 100 meter threshold, that area isn't covered. And so what really matters too is that, or I think what this point really emphasizes, is that barriers are not always caused by one dramatic obstacle, right? And that can be the case, right? Somebody in a wheelchair, you hit a step, no matter the size, that's a dramatic obstacle. But when we're thinking about some of these hidden barriers, they're often produced through accumulation, a long distance, a heavy door, no place to sit, poor lighting. Individually, any one of these features in the built environment might be treated as minor, but taken together, they can make participation impossible. And this is the part that matters, is what do our systems notice? Across these examples, washrooms, lighting, rest, the question is not whether the barriers exist. Of course they exist, right? Today is all about Breaking Barriers Day because we know barriers exist everywhere, but especially in our built environment. I think the deeper question that we really need to interrogate is, what do our systems notice? What do our maps notice? What does our databases notice? What does our audits, our work orders, and our planning processes notice? And even more importantly, perhaps, is what do they fail to notice? Because when a barrier is not recorded, it's easy to ignore. When a barrier is not mapped, it's hard to prioritize. When a barrier is not measured, it's harder to fix. And when a barrier is treated as an individual inconvenience rather than an environmental problem, the responsibility shifts onto the person experiencing the exclusion. And so this is where mapping can be very powerful. A map doesn't solve accessibility on its own. It makes patterns visible. It shows where barriers cluster. It shows where buildings could potentially be underserved. It can show whether an accessible washroom is close to where people actually need them, or where seating is missing, or a route could become difficult at nighttime. It moves us from something we didn't know to now we can act. But the data has to come from somewhere, and this is why community knowledge really matters. And so that is my invitation, to tell us your barriers. We'll map them. This is ongoing work, and your knowledge of these things are very helpful for us to understand. So if there's a barrier you think our campus systems are not seeing yet, or our cities are not seeing yet, I want to know about it. It might be something physical, like a door, a slope, a surface, a missing bench, or a washroom feature. It might be sensory, like lighting, smell, sound, crowdsourcing, or wayfinding complexity. It could be temporal, like a route that works during the day but not at night, or a space that becomes inaccessible in winter. It might be social, like a place in the built environment or where it says it's accessible, but your experience says otherwise, as we see, in the hotel example. Yes, we're fully accessible, but the reality is that they're not. And then it's the goal of my team to work together to decide what data to collect, how to map it, and how to turn it into change. The goal is not to create data just for the sake of data. The goal is to make barriers visible enough that they can no longer be dismissed as an individual problem. I'm going to move on from this slide, but we have a booth in the exhibitor hall, and so I encourage you to come see us. The QR codes will be on the desk there if you have other things that you want to contribute. And this, I think, really is picking up also from what Bonnie said about, seeing barriers and how to remove them. For me, as for breaking these barriers, it's less about how to remove them and more about who. This summer, our Accessibility Research Excellence Cluster is looking at hidden barriers across different everyday environments. And so we have some really brilliant researchers, Harrison Drew, Lisa, Taisir, looking at different campus barriers, at washrooms, and digital mobility barriers. And then Mena, Mary, and Mosima are looking at parks, libraries, and places of worship. And so their goals is not just to understand, okay, barrier, data point, what does it look like, but what does it look like in the process of trying to use these spaces, of trying to actively engage in parks, libraries, and places of worship. And I'm so delighted, too, that we also have Dr. Cassie Boyd has recently joined my research team. Her background in community rehabilitation science is very helpful, again, to think not just about barriers and maps, but what are the systems that we can use to actually develop those. And I'm happy actually to see this as well, even Bonnie's background in interdisciplinary research, that the Institutes of Transdisciplinary Scholarship, I think, really embody some of this work, that it's about developing research that solves real world problems in collaboration with the people that those problems affect the most. And so I'm so thankful to have their support as well. And so I just want to end on an invitation also to stay connected. If this work resonates with you, I invite you to to join UCAN, the University of Calgary Accessibility Network. This network is a way to stay connected to accessibility-related work across campus, the city, and beyond. It brings together people from different disciplines, roles, and experiences. And so we've had a LinkedIn page for a little bit, but we also have a new mailing list, UC Access, so that we can share events and things like this. Because breaking barriers is not something that one person or one office or one research project can do alone. It requires many people learning to notice differently, and it requires us to take hidden barriers seriously. Thank you.
Thank you so much, Dr. Fast. Let me make sure I can turn the mic on. Can everyone hear me? Perfect. Okay, thank you. That was amazing. I'll just start in with the questions if that's
Great.
okay with you. So the first question is, are there any barriers in participating in some of your apps or mapping that could decrease people with disabilities from actually participating? And how do you navigate that?
Oh, yeah, digital mobility barriers. I suspect that's what we're talking about, right? Is that sure that we can ask you about your barriers, but if you actually can't, scan a QR code, right, that you're not actually able to get that information the same way. So I think there's so many barriers. I think it's just about I think this is as you opened it, just, try your best and, work towards solutions together and taking the burden off of individuals and making it more of a systems problem.
Yeah. I guess building on what Bonnie mentioned as well, there's no Alberta Accessibility Act. So how do you think the best way to start engaging people to build those systems is? Do you think it has to come from policy or legal frameworks, or where do you think that stands?
Yeah, all of the above. And I'm a geographer. I specialize in mapping. I started this research a decade ago because my dad was in a wheelchair and he said to me, "Hey, build me a map so I stop getting stuck." And I was like, "Sure, no problem. I do mapping. This is going to be so easy." And I realized it wasn't, not because I didn't know how to map, but because you have all of these system level exclusions that, there was no data, and then there's no curriculum, and there's no kind of standards, and all of these things were so compounded, and that's, I think, the newest part I'm trying to understand is where is that policy to actually influence change? And I'm really excited that I have a new PhD student starting in the in the new transdisciplinary research PhD program, specifically looking at policy and that comparative policy across Canada, because we know Alberta doesn't have an Accessibility Act. I don't think they're going to get one, at least in this government, right? It was just shot down. And so, what impact is that having? What do we see? What impact do we see that having on the ground? And I'm so excited that Stephanie Chapur is joining that supervisory committee as well. So we'll have a bit of a law perspective, bit of a policy, communication and media perspective as well in that.
That's awesome. Thank you. Someone has asked, does the University of Calgary cleaning standards address surfaces that might be lower and touched by people who use wheelchairs?
Yeah, I don't know the answer to that. So is the cleaning process? I don't know enough about that, but my guess would be no. Yeah, my guess is they just don't see it.
Yeah. How can we start getting people to see it, like we in the room? How can we go out and start helping people see some of those things?
Well, this was part of the advocacy work. We put so much time into research, but we actually need to put a lot more time, or maybe even equal amount of time, right? It's like you do this, you spend all this time writing this grant, you spend all this time doing this research project, you publish a paper, and then you do the tiny bit of extra work. But it's how to mobilize that knowledge. And so actually in the work we're doing with Pedesting, we met with facilities and some decision makers on campus. They saw the bench map and the VP of facilities was like, whoa, we need some benches in the parking lot. That's our next priority. So I would expect throughout the summer that there will be benches in the parking lot. So it's just about sharing our research. I think we're all doing great things, but how do we do great things that then lead to change? And that's what I'm really trying to focus on right now.
That's awesome. Someone has asked about, have you started to map out places that might lie flat for people with chronic conditions like chronic fatigue syndrome, narcolepsy, postural orthostatic tachycardia syndrome? They don't just need places to sit, but also a place perhaps to lie down or even nap.
Yeah, I love that. Let's capture this as part of our kind of understanding the barriers. So it's not just about places to rest, but it's about places to actually lay down. And I am certain these are under mapped and under served in our campus community, and I think other communities as well, because it's about balancing some of those safety aspects. And so let's add that. I that's one thing we haven't mapped yet is where not are there just places to rest, but where are there places to actually lay down.
I love that. So we're building the collaboration here as we speak, building ideas. That's awesome. Someone has asked, they work with athletes. What barriers have you found in recreational spaces in the University of Calgary and the City of Calgary?
Recreational spaces, it varies. I think the big thing is, talking about accessible parks and saying, oh yes, this is an accessible park, but we actually don't know what that means. And then, so somebody says it's an accessible park, but for who and what conditions are actually exist in those things. And I think this is because there's so much kind of subjective data collection that it's like, is this park accessible? Yes. Like, what is the actual data? What is the surface type? What is the approach type? What are the different types of equipment that's available? Is there a sensory reduced space available? So I think that's a big one. And when you were starting that, I thought you were going to talk about medical facilities. I am so shocked about how poor the access is in medical facilities. And right, this is all part of these compounding barriers. And I think it's the same thing, right? We just, what if we map all the doctor's offices across Calgary, how many of them have a wheelchair accessible exam room? So many of them don't at all.
Yeah, I'll share an anecdote. I moved to Calgary and physiatry existed here for 30 years. And I run a wheelchair seating clinic and work with a lot of people who use braces and gait aids. And when I moved here, there were no clinic rooms in our physiatry clinic that had a mechanical lift. So it was just shocking to me. This is a rehab clinic. How could this even happen? And it took about 2 years of having patients write letters with me to get one put in. And now we have 3. So I'm very proud that that has changed. But yeah, big issue. Building on that, there is a big divide. You work on main campus, and we are now on Foothills campus at the University of Calgary. Have you thought about mapping Foothills campus, and can you speak to any kind of global barriers, if you have, that you've seen here?
Well, this is my camp team. We're doing some brilliant things, and they have mapped Foothills for the washrooms, but we haven't really looked at much more than that. You're right, that 16th Ave, is it 16th Ave divide is like really real. So haven't done all that much, but am eager and wanting to do more. So yeah, please come talk to us, share. Our researchers are here. We have the Accessible Mapping Research Lab has a booth, and so we're available to just chat with you. So share your barriers with us, right? That's part of like conversations is what is breaking down these barriers, and then being like, hey, let's do a research project of like, medical tables in Foothills and in other clinics, right? That's where it starts. It starts with an idea, turns into a project, and then advocate, and that's what we use to advocate for change.
That's awesome. So that question was asked by Mary, who works at the Precision Equity and Social Justice Office, if you are willing to connect during one of the breaks. Someone else has also asked, as a researcher, how can we improve environmental accessibility in our research spaces on campus? Have you done any work about that?
That is a tough one. So accessibility in our research spaces, I think the big one for me is that because disabled perspectives are so systematically left out, that we, it's challenging in the physical environment, to get to university, and then to make it all your way through to be a professor, and then professors kind of are really I would bet statistically are underrepresented or underrepresenting disabled perspectives. And so that's just not incorporated into our curriculum and our ways of knowing. And it might seem more obvious for somebody who's in community rehabilitation, but I'm in geography. I'm teaching geographers, engineers, urban planning, urban design students, urban studies students, and in all of their degrees, we don't talk about disability, yet we directly affect how accessible the built environment is. And so, going back to the research environment, it's just about noticing, and to me, it's about training the next generation. So last summer, our big project, this summer, it's about mapping these various areas of domain, but last summer, we all worked together and created an open educational resource to integrate disabled perspectives into GIS curriculum. So how do we even get people who do kind of mapping and built environment kind of work to know how to do that, and then empower them to integrate that into their classrooms? And I think if you start hearing about this, in high school or even elementary school and then in undergrad, you're more likely to bring those perspectives forward in the work that you do and the people you're training, right? So I guess it all comes down, this is system level change that we need, and everything we can do to break down those barriers, the better.
This will probably be the last question, but you led right into it. So accessibility looks really different, as you mentioned, for different types of people. So that can create a really long list of improvements. There's often financial and time constraints. So how do you sort out prioritizing which of those things are addressed first?
Yeah, that is a big one. I think it's about looking for those missing perspectives, and that takes more time, right? So a lot of people, or we have open data catalogs, so a lot of researchers, do decide their research projects based on what data is easily accessible. And so it's about looking for that data that isn't there, and then working on those things as well. It's not just about prioritizing what you see, and then doing work on that, but really interrogating the whole process and figuring out what isn't there. And then I'd say with anything, it's that advocacy piece of how do we actually use this to enact change. So are you having a conversation with the City of Calgary or designers or planners or medical students or pre-med students about how these barriers are really important, right? I'm hoping there's aspirational med students here. You're going to be or physiatrists and other physical medicine specialists, right? You're going to be opening clinics. Think about the physical access of those, right? It's all of our responsibility. It's a shared responsibility.
Amazing. Well, thank you so much. That was a really great talk.
Thank you, everyone.